Hello, Andrew Kolsky here with National Sleep Network, and today we have an exciting guest, Dr. Funke Afolabi-Brown. Dr. Brown, thanks for being here. Can you introduce yourself to the audience?
Yes, thank you so much for having me, Andrew. I am Funke Afolabi-Brown. I am a sleep medicine physician with expertise in pediatric sleep health. And I do a whole lot of things, including speaking about sleep, including coaching and consulting. And I also have a sleep medicine practice.
Fantastic, fantastic. I'm sure some people listening to this podcast are wondering, speaking about sleep, that's got to be exciting. But of course, I deal with the same issues, so I get it. It actually can be exciting. Um, so so give us the benefit of learning a little bit about you. What drew you to sleep medicine in the first place?
Yeah, so really, I think like most people, right? It was my personal story. So one of the things I say really is I help busy women and children change their relationship with sleep so they can thrive and live to their fullest potential. And the reason why that's my mission is because I was that busy woman with kids with no sleep, and it was impacting me significantly. So right from medical school, right? I started off in a very competitive program in Nigeria where, I mean, you pretty much were guaranteed to not graduate until proven otherwise. So great morale booster, right? So I started off really exhausted, really burning the candle on both ends because I wanted to do well, right? And then moved here, relocated to the US, and I needed to suddenly prove myself again. So started working twice as hard because people didn't know me, and I wanted to prove that I deserved to be who I was, on a mission to be. And so that really took a toll on my entire health and well-being. Over time, it was really sleep that I struggled with the most because I now had a combination of sleep deprivation and insomnia. And I always tell people it's two different things. Many times we sometimes use it interchangeably, but for me, I didn't have the opportunity to sleep because I was taking care of other people. I was taking care of my children, and I was just not on the priority list. So I
Mhm.
had sleep deprivation as a result of that. But then, even when I did have the opportunity to sleep, I couldn't. So busy day, getting to bed exhausted, and then my mind just would not stop going. And so I struggled with that for some years, and then eventually kind of took myself through a lot, what we now know as the standard of care, which is cognitive behavioral therapy. I got some therapy myself, worked on a lot of my mindset, setting boundaries, and my life changed forever. And so, it was almost like, oh my goodness, somebody else, other people need to hear this and be better because I've made these changes and look at where I am now.
Mhm.
And so that really motivated me to pursue my sleep medicine fellowship at the University of Pennsylvania. And now the rest is history.
Wonderful, wonderful. Well, that's we had a chance to chat before we started the video here, and I was saying that I feel the camaraderie. I got my training at University of Pennsylvania Medical School as well, and I really enjoyed it. I think it's a absolute top-notch program. The people there are just wonderful, and they know what they're doing. So I know you got a really good education. Um, so can you give us the benefit of defining, you said there's a difference between insomnia and sleep deprivation. Can you sort of define the difference for us so we have a clear understanding?
Yeah, so with insomnia, we really think of that as, the difficulties falling asleep, staying asleep that people experience. And really, that's in spite of adequate sleep opportunity. So, meaning that you get into bed, maybe you get into bed a little bit earlier than you typically would because you want to give yourself an opportunity to try to sleep. And it's just really hard for you to fall asleep or you have challenges staying asleep. With sleep deprivation, what's happening now is because of either behavioral choices, because of either some medical issue, because of environmental factors, you get into bed and you're not able to get sufficient sleep. So there's inadequate sleep opportunity in that case. And so, I think it's a very big difference because the approach to addressing those two entities is completely different, right? If
Right.
you have insomnia, we're going to try to reduce the amount of time you're spending in bed trying to fall asleep. But if you have sleep deprivation, we're going to address it by saying, well, try to get more sleep, and then let's figure out if there's an organic problem or like a sleep disorder that's contributing to your sleep issues.
Right. Right. No, makes a lot of sense. So when you talk about the fact that you deal with women and children, I'm going to assume that probably a decent part of that, especially if we're talking young children, like babies type of young children, there's probably a lot of sleep deprivation.
Yes.
So
Yes,
what do you do?
for most of the moms that come up. So the thing about it, and the reason why it was really, with my practice, I couldn't separate both. I couldn't say, I'm going to fix your child's sleep. If I'm talking to a completely exhausted and sleep deprived mom is going to do anything, including maybe co-sleeping with her child or whatever it is to get some of the sleep she needed. So we needed to look at the child's sleep from a family's lens, right? So like you said, babies, right? I take care of kids across the entire age spectrum. But for babies, for instance, or newborns, during that period of time, they're not expected to. They sleep in bursts because they don't have a well-regulated circadian rhythm. So in that case, we're really making the best of what we have. We're really trying to get mom to prioritize her care, to set boundaries, to ask for help, to start to create routines, even in that baby, such that we're setting them up for sleep success. And we're creating an expectation. Like, I am not expecting, like, a mom of a newborn to sleep 8 solid uninterrupted hours, unless she has like a baby nurse or something
Right.
that takes the baby from her. And there's nothing wrong with that. If you have those means, please take advantage of all the help you can. But as they go through, babies then start to develop, more of some of the behavioral sleep issues where they've become very used to being rocked to sleep. They become very used to being bottle fed to sleep. They've become very used to the parents sleeping with them. And so now they start to develop issues where they want that parent to be present. They want that bottle. They want whatever it is that they've become used to. And so we are really implementing sleep training and behavioral strategies to work on those things and helping mom understand this is where the work is, because we need a parent that's motivated enough to want to see those changes. So setting a goal where she's like, well, I'm tired of being tired. I'm tired of living in a fog. Okay, that's the goal. These are the paths that we're going to use to get there, especially if waking up multiple times to attend to your baby is a barrier to getting to that goal.
Mhm.
And then, as they get older, as they become toddlers, as they become school-age children, those issues again start to evolve and emerge. And so we're really trying to look at it again, really looking at this as a partnership and not just about us saying, oh, XYZ, that's what you got to do, otherwise nothing, right? So really empowering the family with options so that they leave, and when they come back, everybody is well rested.
Right. Wow. Wow. I can imagine though the amount of struggles that people have trying to work through all that, especially, you think of like a single mom with a young baby,
Mm,
the work schedule and the childcare schedule and the feeding schedule, just all
mm,
the parts has got to be incredibly difficult.
mm, mm,
So
yeah.
so take us through a little bit as let's talk about the baby, toddler, child, kind of that
Mm,
progression. What types
mm.
of issues do you see, and do they change as the ages change?
Yeah, that's a great question. So, within the baby stage, or I think regardless of what stage, when I look at sleep issues in children and adults as well, actually, we're looking at it from three main categories. And this was really one of my mentors, Judy Mindell, that taught me this, and it's just stayed with me. And it helps families understand what's going on. So you have medical sleep issues, right? So those medical sleep issues can be things like, sleep apnea, restless leg syndrome, periodic limb movement disorder, and some other ones. And then you have the kind of the behavioral bucket, which I usually will say it's not like your child has bad behavior. They just have habits that is now affecting their sleep. So, you know, they're watching TV, they have screens on, they are drinking caffeine, they have an irregular schedule, all those things. And then the last are the, you know, the 24-hour factors that can get in their way of sleep. So you have that child who has ADHD or autism or anxiety, like those things don't go away when they're going to sleep. So when we now have those breakdowns, then we look at the different stages and what could be in those different categories. So like you said, a child, an infant, for instance, you know, they might have sleep apnea. They might have reflux. They might have asthma. They may have, you know, ear infections. They may be teething, and all those things can affect their sleep. So we're doing a deep dive into that, because until we figure out what the root cause is, it's going to be hard to address what's going on. And then in that group also, there's sort of the behavioral bucket, right? You know, there's this bedtime codependence. They can't sleep without a caregiver in the room. You know, they're waking up frequently to take a bottle. So a lot of that is what we call behavioral insomnia of childhood. And then we kind of help with getting the child to sleep independently. And then, you know, as they get older, so we're talking like, you know, a toddler, you know, it's still a little bit similar. We may start to see more sleep apnea in that age group. But then the behavioral piece, especially when they're now out of their crib and they are, you know, running around the house and they have multiple requests, we start to see more issues around limit setting. We start to see more issues around sometimes, you know, sometimes they're picky eaters. So we may actually notice iron deficiency. So we may start to see more restless leg syndrome in that age group. And then, you know, by the time they get to school age, you know, again, it's similar, but then it's a whole different set of behavioral things. It may be them now insisting they want their iPad to go to sleep. Or now these kids, especially within that early, you know, maybe preschool to early school age, they start to imagine things. They're seeing monsters under their bed. They're having multiple curtain calls at night. They're having multiple demands. And what this does do is that it pushes their bedtime later, and of course, it makes it hard for the families to be able to get the sleep they need. And then, you know, by the time we start to get to the teen years, it's a lot more around anxiety and mind racing. So we may start to see that insomnia, that form of insomnia that we see even in adults, right? So they're starting to stress out about their inability to sleep. They might also have sleep apnea. They might also have restless leg syndrome. And then a lot of teenagers are night owls, so they may not be able to fall asleep until super late. And so we really need to work on, you know, sleep scheduling issues and things like that.
Wow.
So yeah, so I think it's really helpful, because then you can say, okay, this is the age of the child. What are the unique problems with this child at this age? And then we can then build interventions around that.
Mhm. Well, it's very educational, and you said something in there that really kind of raised my interest, and there may not be an answer to it, but I'm going to ask because maybe you do have an answer to it. What is the deal with kids when they start to think there's monsters under the bed? Where does that come from?
Oh, I do have an answer to that.
Oh, okay.
It comes from just their vivid imagination. You know, and you know, that's the stage where their vocabulary is growing very rapidly, their ability to dream. We start to see that. And then, you know, they might be in school, right? So they're hearing stories, they're watching other cartoons that are bringing up these images. So that's really around when we start to see that, right? That magical thinking starts to emerge. And so they tend to do that. And so really many times what we're trying to figure out is where's the exposure coming from, especially if it's the problem that's very disruptive. So is it like they're watching TV too late in the day, or are they having caffeine, or are there things going on that's really making this more prominent?
Wow. Wow. Interesting. Thank you for sharing that. I just
Yeah.
never really thought about it. And then you said it and like, oh, that's interesting. So, so let me ask another question since we're talking about children and kids and babies and toddlers and all. I know through my own reading, there's a lot of different opinions out there, and I don't have an opinion on this issue, but the issue where some parents have the child sleeping in the bed with them and others who won't do that. Is there a pro or
Mhm.
a con on either way?
So the American Academy of Pediatrics, as well as several other pediatric organizations, recommend against sharing a bed with a child, especially an infant under one, because there's a higher risk of asphyxiation or suffocation, what we call sudden infant death syndrome.
Mm-hmm.
So one of the things we talk about the safety of children, the ABCs of safe sleep in an infant, is that a child should be asleep alone on their backs in their crib or bassinets. So that's the ABC. And the reason why is we've seen that when this change started to happen, we saw a decline in the risk of SIDS. Now, there are families that opt for co-sleeping with their child because one, it might make nursing easier, right? The parent is tired. So instead of, taking the child back and forth from their bassinet or crib, they just put them next to them. But then I think the other thing we have to realize is those exact parents who are so tired and too tired to put their child in the crib are probably so tired that they might actually fall asleep and, God forbid, roll over or have the child suffocate unintentionally. And
Mm.
so I think the risk is high enough for us to say, you know what, this is what our recommendations will be. As a sleep specialist, as someone who also is a pulmonologist, I've seen some of this deaths or near death experiences that you just need to see one to say, I don't think it's worth it. I do not think it's worth it.
Right. Wow. Wow. Interesting. Okay, that makes a lot of sense.
Mhm.
So, so then my next question would be, since you said that you're focusing a lot on women and children, are there
Mm.
particular issues for women that are unique or more prevalent in women than men?
So very, very good question. So one of the most common is hormonal issues and I would say insomnia as well. Insomnia tends to be more prevalent in women. But the problem is that sleep disorders in women overall are generally underdiagnosed because of multiple reasons. The presentation for something like sleep apnea is different. Many times it's different in women than in men. So women are less likely to have very loud snoring and pauses, but they're more likely to have things like headaches, chronic non-specific headaches, fatigue, daytime sleepiness, depression. And unfortunately, because those specific symptoms are not necessarily clear-cut for sleep apnea, they may go ahead and get diagnosed with thyroid issues or with depression or things like that. So that's one unique. The presentation itself makes it really unique. And
Mhm.
then when it comes to insomnia, I think a lot of women suffer with this because of many reasons. They're extremely busy. They don't have time to relax or pause. They don't have time for self-care. And so their minds are constantly racing. So we might see that also more prominently. And then, finally, we have things like uh, things around menopause, right? Or hormonal issues. So with hormonal changes, sleep changes. So even during a menstrual cycle, there's certain times of the month where you may notice that there's a more tendency to be more sleepy than others. During menopause and perimenopause, you're getting lower levels of estrogen, progesterone, those sex hormones, which have an impact on sleep. They tend to decrease sleep quality. They tend to decrease the quality of the sleep that we get. So all those changes can, it's unique to women. And so, or even through pregnancy, right? Women are more prone to have conditions like restless leg syndrome and things like that, which can, affect their sleep overall.
Very, very interesting. So, so you are a public speaker and I think an author, correct? So,
Yes.
so tell us about that side of you. What do you speak about? What is your goal of speaking? What have you written about? Let's learn about that.
Yes. So I speak on the topic of sleep. I work with a lot of organizations. I speak at conferences, and really the focus is really seeing how sleep can impact not just our mental health, physical health, overall well-being and productivity. And so that's something that I've done on various platforms, locally, nationally, internationally as well, especially within, high achieving women, because again, we're doing so many things that sleep tends to take the back burner. And so I facilitate sessions, I facilitate workshops, and I speak on conferences on this topic. And not just to give education about the fact that, yeah, if you don't sleep well, you'll have heart disease, but to provide like what are practical strategies that we can use so that you can get the sleep you need. And really from an organizational level too, like what can you do as an organization to support the sleep health of your employees?
Mhm.
The book is a collaborative book with about 47 or 46 different physician authors, really sharing our story. So some of the things I talked about today, sharing that story with others to inspire people to take action and step out of their comfort zone.
Wow. Wow. Great. Hmm. A lot, a lot of stuff. You definitely are the overachiever that you were describing. I can tell. So, so you hinted at some things that people can do to improve their sleep. Can you give us a couple tips? Like what are some easy things that people can do that they don't do that might help them improve their sleep?
Yeah, a few things. I think the first I would say is consistency. Most people are not consistent. Most people just sleep when sleep comes, and because of that, they don't necessarily set an intention. And so I think having that consistent sleep time and wake time is very important because it helps with aligning your circadian rhythm and so sets you up for better sleep the next night rather than this kind of flip-flop, sleep schedule.
Mhm.
And then the second is having a bedtime routine. So again, as a busy woman, you may be so exhausted and you just go straight into bed and skip the routine. But the issue with that is that your body doesn't get the benefit of kind of winding down before bed. And that might lead to you having sleep issues. And then E is the environment. So making sure that the bedroom environment is optimized for light, is optimized for noise, is optimized for temperature. And so really cool, dark, and noise-free is the goal. And then A stands for assign the bed for sleep. And so you want to sleep in bed. You don't want to eat, watch TV, worry, play video games, do all that stuff in bed because our brains make this really strong association.
Mhm.
And then T is technology. I usually will say, you want to make sure that you have some sort of boundaries around device use at bedtime because all of that can interrupt your sleep. And then finally, it's important to take stock and say, what are the things I need to eliminate? So is it heavy meals? Is it caffeine? Is it alcohol and all of those things? Because all those can interrupt your sleep quality. So the acronym is CREATE, CREATE, which is easy, relatively, and very practical to follow.
Is that your doing coming up with that acronym?
Yes, so that was an acronym I created. Yes, it's the CREATE acronym.
Right. Yeah, I was going to say because I
Because,
hadn't heard that before, but it makes a lot of sense.
yeah, because people Google sleep hygiene and there's just so much information and it feels overwhelming. So this is just an easy way to start off, jumpstart healthy sleep and just kind of get yourself set up for success.
Mhm. Okay. So how would you know, it, how would someone know whether or not they need uh, to even look into their sleep habits? Like, some people say, yeah, I'm tired, whatever, but it's because of this or because of that. What would be some clues for someone to know that maybe they should look into something that they get help with?
Yeah, so a few things. If you notice that you get, again, most commonly people are sleep deprived. So you want to make sure you get at least 7 to 9 hours of sleep. But if you notice that you're waking up tired despite trying to get as much sleep as possible, if you notice that you're having daytime effects, so daytime sleepiness or, mood problems that you feel could be related to your sleep, then it's definitely time to seek help. If you have symptoms like snoring, restless sleep, difficulty sleeping where you're reliant on medication or different other things, then it's probably time for you to seek help. And I would say then if you, of course, if you have, I talked already about like the sort of the insomnia, right? If you've noticed like it's been 3 months and you're really struggling with the sleep issues, then you should probably reach out for help.
Mhm. Wow.
Mm.
Okay. So because you're such a wealth of knowledge, um, I have one other question. Again, you may or may not have an answer to it. So, so one of the issues that I think many people struggle with is
Mm.
if you have a bed partner and one person is a loud snorer and maybe likes to stay up and read with the light on, and the other person is trying to get to bed and can't sleep. Any tips on how to mediate some of that?
Earplugs. But I would say to start, I would want us to figure out why that person individual is snoring, because they might have sleep apnea and it's a serious condition. It is treatable. So I think a gentle, and I've had people struggle with, well, how do I speak with my spouse? They get very defensive when I ask about their snoring. And I say, don't make it about you, make it about the person. Like, I am worried about these symptoms. And I heard, listened somewhere that this kind of loud snoring can be associated with sleep apnea, which has very, negative effects. And so not coming from a place of, oh, you're disturbing me, you're interrupting my sleep, go get checked, right? So I think that's the first thing. So you want them to be healthy, you want them to be well taken care of. So that would be the first thing. And honestly, yeah, I think a few things that you can do as they go through that process of getting evaluated is earplugs, white noise machine. Sometimes just playing that on your side of the room can be helpful in masking out that noise. A fan, it could work. Noise canceling headphones can also work. And I would say this is something that, especially with working with a lot of couples that I have, is sometimes you do need to sleep in separate rooms at least temporarily, because now you have somebody who maybe their spouse is snoring, so they're getting very fragmented sleep and they're cranky and irritable in the morning. And then you, as the partner, you're not sleeping well because your sleep is interrupted. It doesn't make for healthy relationships on the long run. So if we say, you know what, we're going to spend time connecting in the evening, we're going to spend time with intimacy in the evening, and then while you're getting evaluated or treated for your sleep condition, I'm going to sleep here so that when we come back together, we're not both irritated at each other, because now I'm coming to you from a place of rest.
Right, right. So those are some good tips, and you mentioned in there something important as well about someone with loud snoring, how they may have sleep apnea. And
Yeah.
in the work that I do and the research that I've been doing, I've seen a lot of different studies, and anywhere from 50 to 85% of people who are prescribed a CPAP machine for sleep apnea end up not using it either within the first 2 weeks or at least within the first 6 months. And I was looking at the graphs of the big drop off of usage. And I think a lot of people with apnea may not be fully aware of the risks if they don't use their machine. Can you
Yeah.
share with us just a little bit about why it's so important to treat sleep apnea if you have it?
Yeah. So, sleep apnea, as untreated sleep apnea, has been associated with so many negative effects. So we could start with the heart, right? Heart health and sleep apnea. In fact, one of the American Heart Association included sleep as one of their pillars of health. So really critical, because there's a higher risk of, hypertension, of strokes, of, heart attacks, heart rhythm issues, heart failure. All of those things are related to interrupted sleep because of sleep apnea. The other thing I would say is, mood issues, anxiety, depression, bipolar disease, all of those things can emerge when you're not sleeping well. And then, there are also studies around, like things like memory problems, executive function, increased risk of dementia, all of those things. So there's a lot at risk, and relationships, of course, are going to suffer as a result of that. So I think there are strategies with the right coaching, the right counseling, the right therapy. You actually can tolerate wearing CPAP. Now, fortunately, in some certain situations, there are also some alternative options like oral appliances, the hypoglossal nerve stimulator. Those are also options that we can use, but needs to be tailored to your needs. And so it is important to note that, like, this is a condition that's treatable. This is something that if I don't treat it, has deleterious effects, and then you can address it.
Yeah, no, thank you for that, because even just within the last week, I'm thinking back to the number of articles that I've seen about people who were in early stages of dementia and then made
Mm,
a lot of life changes, and within a couple
wow.
of years after that tended to turn things around, or at least it didn't get
Mm,
worse. And
wow.
sleep, diet, exercise, all these
Mm,
things are part of their plan. And I know that's a
yeah.
big, issue today that people are thinking about a lot, because you have the baby
Hmm.
boomers who are, moving towards those ages and things, and
Yeah.
it's a challenge. So
Yeah.
so okay, so if somebody is listening to this podcast and they're
Mm,
resonating with some of the things that you're saying, and they want to try to get in touch with you, um,
mm.
do you work with individual clients?
Yes, yes, through different ways. So through my clinical practice, I'm licensed in California, New Jersey, and Pennsylvania. So children, and adults who have issues with their sleep, either can't sleep or won't sleep, or just some kind of general difficulty sleeping, sleep apnea, insomnia. We see them, and we offer both telemedicine and in-person practices, in-person services, so they can come visit us in our in-person location, and we can also see them virtually. And then through my coaching, especially for moms, I offer one-on-one coaching where we're dealing with the mindset, with the habits and barriers that are getting in your way of getting good sleep. And so if you go on my website at the restfulsleepplace.com, you'll see both practices. And so you can kind of learn more and then, schedule a call to talk.
Great. Okay. So can you say your website one more time?
Absolutely. So the website is www.therestfulsleepplace.com.
Okay. So it has the as the first word, the restful sleep
Yes.
plan. Okay. Just want to make sure so people don't miss it if they're trying to find you.
Yeah,
So,
absolutely.
great. Well, I cannot tell you how much I appreciate all the information you've been able to share with us today. That whole area dealing with children and motherhood and all those things have such unique issues, and it takes someone who's specially trained to be able to understand them and help with that. So I'm glad that you're out there doing that, and I really appreciate you coming on to share the word and educate us more about things.
Yeah, yeah. Thank you so much for having me.
We really appreciate you being on.